Thank you. Good morning. You know, whenever I participate in these kinds of events, I tend to mingle in the hallway over coffee and I just listen to conversations so that I can pick up a couple of things that I might use in the presentation. So what I learned this morning was, man, that Glassman guy, he's brilliant. I'd actually pay money to go see him. Man, that Hoagland guy, he's brilliant. I can't wait to hear him speak. So if you've ever had an exam where the question is, which of these things don't seem to quite fit, you're looking at them. And to make matters worse, the topic is forecasting, and my portion of it is forecasting healthcare. So with complete certainty, I'm going to tell you what's going to happen in the healthcare arena over the course of the next few years. Yeah, not so much. So that's not going to happen. But what will happen? This thing actually, yeah, it does work. We're going to take a look at least how we see the world changing, how our clients and their employees are responding, and then maybe some insights into the key challenges and how to more effectively manage those. So how's the world changing? This is one of my favorite slides because it's the duh, tell me something I don't know slide. So we're older, we're sicker, and we're consuming more healthcare services, and it's more costly, and the government's not helping much. Okay, so we can move on to the next one, but we'd be missing a couple of things. So for example, with the cost dynamic, the Healthcare Cost Institute did a study that looked at 2011 to 2016 experience. And what they found was, surprisingly, healthcare costs went up. But interestingly, within that study is the fact that usage was relatively stable. So if you go back to the old formula of cost equal price times volume, if your volume isn't changing all that much and your costs are going up, what's left? You apparently have a price problem. And this is actually made a little clearer when you look at brand drug utilization. Brand drugs declined in use by 38%. But overall brand drug spend in that same period went up 110%. So clearly there's a pricing dynamic, and what struck me as I looked at the results, most of the employer strategies over the past few years have really focused on changing people's use patterns. Case in point, the high deductible plan. And so if that kind of had an effect and we're seeing relatively stabilized use patterns, I can safely predict that the next wave of activity is going to focus around payment and potentially paying for value. Another item that I thought I'd touch on this chart is the little purple guy. I don't know if everybody can see purple up there, but that says slowly. And it refers to the industry and the pace of change. And I think when the slide was first put together, it was built off of a frustration that some of the network changes that we were expecting, a lot of the alternative care delivery models, the movement towards pay for value really wasn't accelerating at a pace that we wanted to see. And then all this stuff started happening. And so as you can tell, there's been a tremendous amount of change recently, and a lot of it stems from organizations basically acquiring other organizations, or organizations becoming frustrated that they're just going to create something new. So whether it's within the core business or within the industry, or companies that literally are saying we want to be a disruptive force within the industry, most everybody is jockeying for position, and what they're trying to do is, in essence, have some level of control of access points, some level of control over the provider system itself, some level of control over price, data, and the consumer experience. And my sense is that this is not going to change. We are just seeing the beginnings, and hence the question marks. You will see more and more of this in the marketplace. And then this stuff. So I refer to this as the spider's web chart. This is not an exaggeration. This probably is the 5th or 6th version of this chart that I've seen in about 2 weeks. You can't keep up with the pace of change. There are so many new entrants into the marketplace, And they're all trying to do what I just described, have control over access points and the user experience. And furthermore, they're all kind of driven around what I call the 3 S's, segmentation, specialization, and support. So everything that you see here is really geared around trying to address those principal components. One other comment relative to this page, someone a long time ago told me, if you want to understand human behavior, follow the money. Somebody has figured out that there's money in healthcare. That's why you see all of these organizations coming into the marketplace. So how are our clients responding? Most of what you're going to see in the next few charts is data that comes from a couple of surveys that we do annually. One is our employer healthcare survey. Another is a consumer mindset survey. And I can't remember the exact numbers, but we go to like 500 something employers. We get their feedback on a variety of issues. What comes across consistently, and this really hasn't changed too much over the years, is employers are concerned about managing costs. Employers are concerned about offering a competitive level of benefits. One thing that popped up this year that I thought was interesting is an increased awareness of overall well-being of their workforce. And you'll see how this becomes important in a couple of seconds. The other observation that we got was that employers are starting to recognize that they need to help people make better decisions. And so 46% of employers are focusing their future approach around improving decision support tools for their workforce. But unfortunately, the more things change, the more things stay the same. So when you talk to employers and you ask them, do you have a strategy in place for addressing those key concerns that you just identified? They'll all say yes. But then when you ask, well, what are you doing with respect to your strategy? 60% of them will say, well, we're going to change plan design. Another 35% will say, well, we're going to increase contributions. I'm not as smart as these two guys up here, but that's not a strategy. Yeah, it's a tactic at best. And so there's a certain level of frustration with even how employers are responding to this. And what is going to happen is employers taking a step back and starting to tie overall company goals to an actual strategy that helps them achieve them, and then developing the tactics necessary to do so. And it's not going to be plan design and contributions. So I mentioned that a couple of things were important. When we tie the employer perspective to the employee concerns, a couple of points that I'll make. One is the well-being comment. So more and more employees are starting to recognize that well-being is an important thing, but they're defining it differently. It's not just physical well-being, it's economic, it's social, it's psychological, and they're looking for the employer to support them across those dimensions. To the extent an employer can, there is a greater sense of loyalty and engagement and productivity, and so we're starting to see those dots connect. The other interesting dot is the third bullet point, which is the frustration factor. And this really is almost depressing, but 44% of millennials, as they kind of navigate through the healthcare system, just quit. And so the fact that employers have started to recognize well-being as an issue and the need for decision support is actually starting to coalesce with what employees are saying is important. This is leading to shifts in overall benefit strategy where employers are looking at care delivery, health and well-being, and choice and guidance. So what are we likely to see? Over the course of the next few years, and this chart basically identifies what we have in place today, what employers are seriously considering doing. And as you can see, this notion of segmentation comes through loud and clear. We'll continue to see centers of excellence. We'll continue to see narrow networks. One thing that did kind of surprise me is the uptick in on-site care, because that's a different kind of delivery model and works in some circumstances, not in all. That segmentation concept filters over into the clinical management approaches, and so we'll start to see condition-specific high-performance networks, very targeted complex care programs, and again, on-site popped up here as well. And like I said, I think people love the idea, but when you start to break down the critical mass that's required to make that work and the scope of service to make it successful, I think it's more challenging than the survey would lead you to believe. And then finally, the enhanced support. I think what this chart is basically saying is that over the course of the next few years, every employer that we survey is going to do all of this stuff, with particular emphasis on things that are currently in place, like the nurse line and telemedicine. It's all really revolving around helping individuals get to the right resource at the right time. So given all this complexity, what do we need to be thinking about? Well, the first question is, how do we know we're getting value? And we get this a lot from our clients. They basically say, well, there's all this really cool stuff that's out there, and in order to make it work, we have to create benefit incentives. Well, if we create a benefit incentive that has a 10% value to move people to a certain thing, how do we know we got 10% back? And ideally, wouldn't we want more than 10% back? So one of the things that we actually are in process of piloting, and I think we're this close to rolling it out, is a tool that takes claims data from Amino, takes qualitative data from Empirica, smushes it all together, and helps a client understand that if someone comes in and says, we've got this high-performance network, and if you steer people to it, you're guaranteed to save money. Really? Will it improve outcomes? And so we're trying to move in the direction of answering that question, but that's going to be a critical one going forward because there are so many options for employers to consider. One of the other key challenges is we've got all of these wonderful tools that are out there. How do we incorporate them? How do we leverage them in our program? So there are companies that are out there that are using DNA testing to identify cancer markers and as an early stage kind of treatment process. Is that covered today? Should it be covered? There are companies that have diabetic socks. I don't know if you've heard of these, but you wear the socks at home. It's got a monitoring device. It sends information to a data warehouse, and people can intervene if appropriate. Is that covered? Don't know. So employers are going to have to start asking those questions. What, if anything, should we be covering? And who should we be aligning with? Because so many different companies are doing similar things. Who's our right partner? When it gets to data-driven networks, we are not very far away from being able to take that claims data that I referenced earlier or drug pricing data, marry it with qualitative data, marry that with GPS so that no matter where you're at, and eventually it'll get to the point of push technology. I showed up at an emergency room and I might get a message that says, by the way, you could do this down the street for cheaper. So are we incorporating that? And if we are we going to provide incentives for people to actually use these tools? A classic example of this is, Aetna did a study a couple of years ago where they were looking at their transparency tool, so the pricing tool online, and what they found was that 2% of the population actually accessed the tool, and out of that, 98% did nothing with it. So what are we getting out of the different tools and resources? So we have to be able to figure out how to leverage this stuff, and navigation is just the last piece of this. What's the right source? Who's the right partner to be able to help us steer people? Because ultimately what you're trying to accomplish with all of this is getting the patient to the right resource at the right time for the right price. So that's one of the key challenges that employers will face. And why don't we throw in the changing workforce demographic? How many of you have seen a chart kind of like this? Nobody. What do you live in, an egg? So if you didn't realize it, the workforce demographics are changing. We now have 5 generations within the workforce, and the boomers, like myself, are fading away, and the millennials are playing a much more important role. What this really means is that there is no one-size-fits-all. Most of the benefit design structures historically have been geared around a singular population. We now have to recognize that we've got different constituencies to which we have to respond. And that has led to an increase in interest in what everybody keeps referring to as flex. So yes, what is old is new again, and yes, we are talking about flexible benefits, but it's a little different because technology has made it so that this can be done on a more affordable basis, and the range of benefits that are being considered go far beyond what we used to see in traditional flex plans. But it does raise another question. How do you prioritize your investments? And whether it's a conjoint study or any other kind of analysis, I think one of the key things that employers are going to have to do is try to identify the needs and really more importantly, what employees value in their existing benefits, because they may place significant value on something that doesn't cost a lot. Give them 5 of those. And so starting to match employee need, employee value propositions with where you're making your benefit investment, I think is going to be an important part of the future. We haven't talked about exchanges, but they're still there. In fact, in my former life, I was actually responsible for building out the original Hewitt private exchange. And I thought we'd see much more growth in that arena than we have. And there are a variety of reasons that drive this, but it's still there. There still are a quarter of the employers who we survey who say, yep, well, they're going to think about it over the course of the next few years. The one observation that I will make is that if we erode the tax-preferred subsidy for healthcare, you will see dramatic shifts in the exchange marketplace because employers are really no longer going to have a financial incentive to provide group coverage. It'll be much easier to say, here's a pile of money, go buy on the open market. You may see exchange structures gain significant growth. So wrapping all this stuff up, success is going to require employers to try to figure out better delivery systems, try to figure out how to pay for services more effectively and pay for value, try to figure out how to effectively manage complex care, try to help people navigate to the right resource, and also create adaptive models that address everybody's needs across a rather diverse employee spectrum. Pretty easy, right? But that's the task, and I don't think you can isolate any one element here. You kind of have to do the whole thing. So I'll leave with this slide, and we talked a little bit ago about Uber and Facebook. A couple of observations. One, the smartphone came into vogue about a decade ago. Seems like it's been around forever, right? But it's only been about 10 years. And as we look at some of the most successful companies in the world, not just our country, but Uber, largest taxi firm in the country, they don't own any cars. Airbnb, largest lodger in the world, they don't own any properties. And so the whole dynamic of how companies are becoming successful is changing. And just imagine if these kinds of transitions and these kinds of technologies get applied to healthcare, I think that how our industry is shaped over the next 10 years will be really pretty dramatic. So, thank you.